Hey guys, Jill from Whole for Life. I wanted to mention one thing to you about peptides. I'm trying to do something at least 2 or 3 times a week about peptides so that we can get the correct information out about peptide therapy. I wanted to talk about a peptide that not very many people talk about, maybe not very many people know about. I am not your doctor. I'm not anybody's doctor. I'm not here to diagnose, treat, or cure you. These are my opinions only. They should not be considered, these things should not be considered medical advice. You should absolutely be working with someone. If it's not us, it should be someone. I wanted to talk to you about the peptide Selank, Selank, and I'll put that on here for you too. Selank has a lot of positive benefits. It is neuroprotective, meaning it helps with the brain. It definitely helps with focus. It has some nootropic effect to it. It helps with cognition, memory, recall, as I said, mental acuity and focus. But there are some clinical trials, pretty significant clinical trials, that are showing immense response with particularly the nasal spray administration of Selank. Everybody always takes a size of what am I trying to say? Anyway, everybody's always happy to hear that we have a very effective peptide that can be delivered through a nasal spray rather than through an injectable form. Now, Selank does come in the injectable form. It does work in the injectable form. It is a little more cost effective in the injectable form. So keep that in mind as well. But the nasal spray shows better, more consistent results if you're using it for what I'm about to talk about, which is any virus or fungus or anything that attacks the nervous system. So think your herpetic strains of viruses. That can be up to and including shingles, obviously HSV1 and 2, but also EBV, and other autoimmune issues that are related directly to the nervous system. So I think it's very important, and I want to get information out there to you about that because not a lot of people know. If you know anything about Selank, you don't know about the protective benefits and the potential symptom eradication for the herpetic strain viruses that affect the nerves and things of that nature. It also is proving to be very positive for other nervous system issues as well, and that's a big, long conversation. But I just wanted a really brief tutorial for you about using Selank for herpetic strain viruses. So many people, especially recently, lots of reasons for that. But recently there has been an insane uptick in shingles. There has also been an insane uptick in autoimmune issues that affect the nervous system. Epstein-Barr, et cetera, cytomegalovirus is another one that is a herpetic strain or has a herpetic nature. So it's far beyond just cold sores and the other thing that people know about. There are multiple strains of herpetic viruses, and this has proven very effective in using this peptide for those things. So I wanted to mention that to you. I'm going to try every day to kind of give you a little known or an unknown fact. Dosing would depend on you and your situation. Again, not medical advice. I highly recommend you work with someone. If you don't choose to work with us, work with someone that is using pure peptides. That way they can get it very specific to you. If you want to work with us, then you do have to have a peptide consultation. But if you have had a peptide consultation at all in the past and you're interested in this, all you have to do is let us know. Reach out to us by phone, by text, and we can figure out if that's a good fit for you, and if it is, then we can get it ordered for you. If you have not had a peptide consultation, then it does require a peptide consultation to work with us, and that is a 30-minute session. You can do it on the phone, or you can do it televisit, or you can do it in person, and then we can get it ordered for you. We don't keep a lot of Selank in stock. I usually do it case-by-case basis, so but it only takes a few days to get in. So I just wanted to let you know, if you are someone who has struggled with any of those types of viruses, or if you have other nervous system issues, you might want to reach out to us and ask us if it's a good fit for you. If you've had trouble with memory, recall, mental sharpness, mental acuity, focus, those focus things that people take medications for, where you can't stay on task and, you know, squirrel, squirrel, squirrel. Really good for that too. Really, really good for mood. So there's even multiple clinical trials out for depression, anxiety. So it's a very multifaceted peptide, but I'm specifically talking to you today about the hepatic strains because I think that information needs to get out there. I hope everybody has a great day. If you have questions, just contact us.